Let's speak to Dr. Harjit Singh Bhatti. He is a senior resident of internal medicine and the national president of India's Progressive Medicos and Scientists Forum. He joins us now from New Delhi. Doctor, thanks so much for your time for us. I know you're probably very busy. Now, experts are now suggesting that the peak of this second wave of the pandemic is yet to hit India. So what's the best way forward? What needs to be done as soon as possible, in your opinion?
First and foremost thing is to try to control this virus. There is no active intervention done by the government or our policy makers that how to stop, how to control the pandemic. And there is only a strict actions was taken like a lockdown or other this like the police measures you can say, but there is no active intervention done. Like there is no increased testing, or there is no, and still now there is no better isolation facilities was made. There is no other ways was find out to cut the chain of transmission. So until this virus goes unchecked, it will goes on infecting more and more patients. And as we are seeing in our hospitals, the hospitals are full of patients, and even there is double the amount of patients was admitted in the hospital, but still many people are not getting beds. And I have never seen this type of situation in my lifetime where patients are getting managed at home, they are managing with oxygen at home, they are giving injectables at home. And home is now every home of our nearby people, they are every home is now converted into a sort of hospital.
Right. Many say this could be expected. So why weren't the authorities ready for the second wave? As you are saying, lack of beds, oxygen, basic medicines at the moment across India.
Yes. Yes, they were they have when the vaccine came, they become very relaxed, and the vaccine is promoted as a treatment of COVID, and it was promoted like this that now because we have a vaccine, now no one will get infected. And there is lots of dependency was done on a vaccine, and other things was relaxed. This has resulted into a relaxation in the minds of people. Also, they also started moving outside without masks, without any precautionary measures. And this whole sort of misinformation, this whole sort of underestimating the virus has resulted into this condition where we are now.
Right. And do you think the government should impose stricter measures earlier? Is it too late now? And can the country speed up the vaccination program moving forward?
Vaccine program is definitely, vaccination is one thing which they have should have done. Apart from that, now we need a very active intervention from the government. Like we need more oxygen procurement, or even you can say that medical use of oxygen is very limited. Most of the use is in the industrial area, so in that industrial work can be halted for the time being, and that oxygen can be diverted towards the hospitals. Other than that, the big isolation centers or containment zones can be made, and even the hospital beds can be increased in certain way. Though this should have been done in the past 1 year, this is totally neglected till now. But still, the government have time if they are ready to give an active intervention. Otherwise, if they just do a passive interventions like lockdown or just a police imposed curfew, that will not going to help many of them.
Okay, Dr. Harjit Singh Bhatti, thanks so much for your insight for us here at TRT World. I really appreciate that.